So, hi, good morning, everyone. I'm Souvik Barat. I'm a distinguished principal scientist at Tata Consultancy Services Research. I'm also a visiting faculty at Middlesex University, London, and adjunct professor at Walchand College of Engineering from India. So, can you go to the next slide? So, uh, in my next 20 minutes, what I'll try to do is I'll just give you a brief introduction of what we mean by digital twin, because if you go to any place, you will see the people are talking about digital twin, but they mean differently when we go to deeper understanding and all. So that I'll try to, and which is very similar what Jody already discussed. So what do you mean by digital twin? And again, we did a lot of work during COVID to construct a digital twin of a city to make decisions. So basically, it helps and maker to kind of introduce certain kind of intervention, what would be the impact and all. So I'll briefly talk about that, and then I'll briefly discuss about our view of developing resilient healthcare system using digital twin. So can you go to the next slide? Before going to the point, so I am working in this field for last 10 years, and we developed a lot of technologies. So though the kind of term digital twin was not so popular during that time, but we thought probably that will make a significant change in the future, and it has a huge potential not only for societal system or kind of healthcare system, but also business system and enterprise. And you can see some of our work along with industry. We could make a lot of impact when it comes to retail, supply chain, airlines and airport, banking and all. Basically, if you would like to understand how future will be, so you have to create a digital twin, and then through simulation you perform a lot of what if scenario, and then kind of once you know that okay, this would kind of work better as compared to other, then you can take those decisions. And some of the kind of, we have a lot of publication, more than 50 publications so far, and then we generally go to different top tier conferences and present our views. And so can you go to that? So coming back to kind of what we mean. So as Jody already explained, it's a virtual representation of any system. It could be a city, it could be a scene, it could be even human. You just create a virtual representation. The second thing is basically sense that system and feed into the virtual representation. So what is the purpose of that is basically you have a behavioral representation of the system, but you need to sync that today you are here, you are attending a kind of talk and all. So that is your state. So that state information you need to replicate to a virtual world. And then you do a lot of analysis. It could be simulation, it could be some other kind of analysis, and you try to find out what will work better in real system. But the point is, you are not experimenting with reality. You are experimenting with a virtual system, which is close to reality, but you are not impacting that thing. So that's why we say it's a risk-free experimentation environment for decision making or other purpose. So it's basically provide you an quantitative way of uh, taking decision rather than taking decision based on intuition. And this concept is not new, as I said. Even if you uh, consider that even during Second World War, people created a representation of a city to understand where they will bomb so that the impact will be much higher. But we are using it in different manner. We using it very positively. And from 2010, NASA actually mandated for any kind of experimentation or any idea, they have to validate first using digital twin before implementing into reality. Why it is so? Because each experiment, so they get a lot of ideas, and each experiment is very expensive and very much time taking. And they cannot reject any of the idea by I don't like the idea. So they have to basically come up with the scientific evidences. So that's why they created a digital twin. Their digital twin is a multi-physics, multi model, and also that's a different thing. But the thing is, they evaluate, and only potential ideas are actually experimented in a reality, because then it will save time, it will save cost, and so on. And we are trying to use the similar kind of concept in enterprise or healthcare or societal space. But the point is, these systems are not governed by law of physics, thermodynamics, or any kind of scientific laws. So there is no such equations that will tell, okay, this is my healthcare system. So you need to deal with a lot of uncertainty. You have to deal with a lot of conflicting objective. And most of the time, as Yodi was talking about, there may not be data. So even if you have very sophisticated AI, but if you don't have data, probably you will not able to do a lot of things. And most of the time, you may have data, but your environment has changed. So those data are not relevant in the current context. So these are the things. So with that, so now I think probably that's the kind of idea I wanted to communicate about digital twin, and it has a very wide impact. It can actually make a lot of difference when you are reimagining your future. And I'll talk about the kind of a case study that we have done during COVID. So, and we have a lot of publications, so some of them are listed here. During COVID, so we all know that we were challenged with, so it's a trade-off between individual health safety and socioeconomic progress. So always we wanted to kind of open the things. We were not happy with the lockdown, but then things were not working as expected. So the thing is, the decision at the point of time was, when should I open a city or a kind of country? What would be the new normal? Because definitely we could able to understand after probably 2 to 3 months that, okay, there will be, we need to define a new normal. What would that be? And when is a suitable time to reach to that new normal, and so on. So, and people generally took decision based on intuition, what we thought probably, if let's apply digital twin concept and see what will happen and all. So what we created, but the thing is, as you have seen, the same virus or maybe same variant actually impacted different in different cities, or even a different part of the city. Why it is so? Because it's not about just a virus characteristic. Definitely virus characteristics make a lot of impact, but then it has other aspect as well. For example, you need to understand demographic aspect of that. What is the age group of how people are living? What is the kind of, who are the more vulnerable? Whether more people are asymptomatic because of their age factors, and all such kind of thing you need to consider. Then you also need to consider city architecture, because even during lockdown, people used to go to kind of buy some essential things, and generally they used to get infection, and when they are at home, they used to spread through the household infections and all. So that understanding city architecture, how people are interacting with the rest of the cities, are also important. And then you also need to understand what kind of interventions are used. For example, what are the administrative intervention, what are the medical intervention like testing, quarantine. So this is what probably you need to consider. It's not about just I understand this disease, or I understand the way disease progress. It will help you to understand how any kind of virus will spread. You need to understand the holistic picture to know how how the virus will impact to the city or in a particular geography. So that's why we constructed a digital twin by combining all such kind of aspects. So we created a digital twin by by replicating virus characteristics, by replicating the demographic factor of the city. We created a city architecture, and also the kind of interventions using agent-based modeling technique. I'll not go into that technical details, but this is what we created. And then we simulated to understand what would be the spread. So if things continues as is, for example, if there is no lockdown, what would be the situation? But if I say introduce a lockdown, you don't have to introduce lockdown in reality. Instead, you can introduce lockdown in the virtual representations and then see what would be the infection spreads over time, or what would be the load on hospital. So these kind of things that we have done. And then you can actually experiment a lot of intervention that you are thinking. So before implementing them, you experiment those using the virtual representation, and that's what we have done. So these are the kind of, and we closely worked with, so we applied this to our city where I'm located. It has around 4 million populations. And then we tried to find out which place of the city will be impacted higher. So these are the different places in cities. What would be the death count if we understand the kind of if the situation continues as is, what would be the source of infection? So through this, we found that most of the infections are from the household. So probably wearing a mask at home could have been solved many problem, but then it was difficult and all such kind of things. Then city administrator, so we closely work with them. They gave us a requirement, or they wanted to know if I open office during first wave, what would be the situation versus if I open shop, because then you have to do a trade-off between applying essential food as well as the kind of economic progress and all. Or if you introduce weekend lockdown, what would be the situation? Or if I force people to wear mask versus and people are not wearing appropriately, what would be the situation? So those are the kind of things that we considered. Then yeah, so you can see some of the representations here, which is each individual is basically represented as a dot. And then there are city things. Some of the places you can see it's congested, so they are slums. Then there are places where people are staying in a probably well-to-do societies. There are people who are commuting and all such kind of thing. And then there are two scenarios just for representation purpose. One is with lockdown, another is without lockdown. So this is how we do a lot of experimentations and try to find out which will work better and all. So and then you can see some of the newspaper article at that point of time, because whatever other model were coming out predicting point of time versus what we predicted is much closer to the reality. Can you go to the next slide? And then most importantly, what happened is after wave in India, people thought the kind of pandemic is over. But then we did a lot of experiment and we found there is a possibility of second wave in India or in our city, which is in March 21st, which we published before. As you can see, the publication date is January 21st, 2021. And we published it, and I have taken this image from directly from the publications, and reality actually happened the same time, so March, end of the March. However, the kind of we expected that second wave will be slightly milder, but then Delta was much violent, and that's why it was slightly higher than what we predicted. Can you go to the next slide? And then that's the kind of thing. And then during again third wave also we kind of evaluated. We not only said that, okay, this will be the situation, but also we explained why we are that. So you can see the kind of delta, alpha, delta, and omicron, how they are kind of contributing and all such kind of things. And as you can see here, the blue line, which is kind of a reported case in our city, and one of the prediction, that is orange line, is matching closely from May, not May, but sometime after May, so June, July type. So June, July 2020 to end of third wave, which we consider the April 22. So almost it matched very closely. So with that, go to the next slide. So with that, we felt now it is time to apply this to not only in a business context, which we have had success, but also useful for kind of resilient healthcare system or probably any other societal problem. And so, but then what do you mean by, yeah, so, but when we started thinking about resilient system, so we found it's actually you need to consider the entire ecosystem. So on one side, you have patient, So you need to understand patient, their various disease, demographic factors, socioeconomic situations, and all such kind of thing. And this, we say it's a more of a demand side of the healthcare system, because it's a demand for healthcare system is increasing, because nowadays there are complicated illness, there are aging populations, there are a lot of chronic disease, and such kind of things. So that is one side. On the supply, or on the kind of how the healthcare provider, there are many kind of network is there. So hospital, then we have common healthcare service, physical, then primary healthcare service, clinics, hospital, and all such kind of things. So that is the other side of the thing. So those are more of a service provider. There's a demand. And in between, there are a lot of support system like manufacturer, medicine manufacturer, instrument manufacturer, supply chain, and all such kind of thing. So in order to introduce a kind of resilient health care system, you have to consider all kind of things. You, on one side, you need to understand what would be your demand, because then you can have adequate. So, and then you need to think about how can I make those demand with a adequate healthcare infrastructure. And then definitely you need to align the support system to meet that demand by providing service. And it's basically from the system thinking perspective, it is a system of system. And there are a lot of uncertainties and dynamics. And as we all are saying, it's a fragmented data. So what we need probably is a robust and resilient healthcare system to enhance health safety for all the populations, and while achieving objective of all stakeholders. So we cannot say that, okay, we should have a better healthcare, but I don't care about the aspect of our economic goal or other kind of objective of other stakeholder like supply chain or manufacturer or even hospital. So it has to be a kind of a win-win situation for everyone to make it more resilient, and then only the stability will exist, and probably we can do much. And go to the next slide. But in order to do that, what we need, definitely we need a lot of sensing. So sensing of the environment, disease, healthcare, health-related concerns, state of the healthcare services and all. Then you need to think about two types of decision. One is I anticipate that this will happen. So this is taken from the typical system theory, but it applies into healthcare system. Anticipate that, okay, maybe in next 5 years, this many kind of dementia people will be there, or this many cancer will be there because of the situation, how things are emerging. So that is the kind of, you anticipate situation and try to align your entire healthcare system and supply chain to meet that kind of demand, and that are more of a proactive decision making. The other kind of decision making is more of a reactive. You are in a bad state. For example, we during pandemic, we were in a bad state, right? So you to recover from that state to kind of the desired state. So still after COVID, we are trying to recover from the kind of that stage where we went in. So these are more of a reactive decision making. So you know the kind of state where you are. Probably you need to find the path from there to desired state, and that's what we are doing at this point of time. And in order to do that, you need to sense various things. You need to sense susceptible populations. You have to sense the demography, healthcare system, supplier, supply chain, and so on. Can you? Now, each of this, the three things that we discussed, understanding disease dynamics. So epidemiological aspect or disease aspect, medical aspect is definitely one. But as I said, other factors also you need to consider. When you create a digital twin, you need to focus on all other things like demography, people behavior, economy, city architecture, and many more things. It is actually a multi aspect, multi perspective, multivariant kind of model that we need to create. And as you have seen for the COVID, we created four aspects like epidemiological aspect, demographic aspect, movements, and intervention. But similar kind of thing if you are considering, let's say, cancer, or you are considering any kind of airborne disease. So probably you need to have a different types of model, different types of digital twin to basically understand what would be the kind of situation maybe in after 2 years, 5 years, 10 years, maybe 15 years, and so on. So this understanding is very much important. We need to work with domain expert. So definitely you have a lot of expertise in medical field, but then you need to work with others to make this kind of digital twin operational. So that's very important, and you cannot avoid that. And historical, just having historical data is not sufficient because environment is changing. Can you go to the next? The second part, yeah, can you just? Second part is understanding network. On one side, you have manufacturers, you have a lot of suppliers. On the other side, you have clinics, community health center, public health center, hospital, and so on. And in between, there is a huge network. And in this network, there is a lot of uncertainty. So, and sometimes they actually create a disturbance because of many things. And that we need to understand, because unless you understand, so definitely demand understanding, which will come from the previous model, but then entire thing you need to understand. So this is one thing that we need to consider. So how much I should replenish for a clinic, because if not ask more, if you are asking more, but if you are not utilizing, probably someone else will suffer due to that. So every time you need to take a conscious decision, and that's why the network or understanding what others require is also important, and that's what probably we need to think about. Then understanding healthcare provider. So definitely you need patient volume understanding, which will come from the earlier model, network understanding, which come from, again, the network supply chain kind of thing. And then what kind of facility that you need to provide. For example, if I take India, so 70% doctors are based out of most of the cities, whereas the requirement, almost 70% requirement are in kind of villages and so on. So in India, only 37% have access to proper hospitalization within 5 kilometers of distance, and they have only 68% patient is having outpatient OPD facilities. So this is not definitely adequate, considering that situation will change, or we'll have more needs, or probably there are a lot of growing, since the people are aging, so they need more support facilities and activities. So how can we provide, or what kind of infrastructure we need to set up, and where is very important that again we need to have a kind of more of ecosystem, lesson study network, and then facilities. We need to align them to make it more successful. So that's kind of thing that we need to think about. And can you go to the next slide? And how we create those? Yeah, just enter. Yeah. So again, coming back to our, so yeah. So you create a digital twin of all these three things, or mini mode. Then you simulate, you create a simulation model, observe the KPI. If you are happy with the situation, you can be fine. But otherwise, what you can do is you can come up with a new interventions, and that intervention could come from the domain expert like you, or even there are now reinforcement learning and learning technique available. So that will help you to come up with the intervention. You apply them, not applying them in healthcare ecosystem, but apply them in digital twin, see the efficacy and all. Once you do that, probably you will understand what you should do to define your next generation healthcare system. And the digital twin could be just one aspect, like patient, or it could be the network, or it could be the entire ecosystem. So how sophisticated or how comprehensive you would like to create it, up to you. It could be very focused or purposive, or it could be very broad and all this kind of thing. So how much effort you would like to spare, kind of put into that kind of effort to design your next generation healthcare system. The capability exists, but what we want to do is up to us. So that's probably we need to discuss and decide when it comes to the kind of situations. So can you, so with last things, so understanding, so definitely at this point of time, come up with a resilient health system is important factor, and that's what we are seeing on. And after COVID, probably, as Jody also saying, there might be more number of epidemic. We need to deal with that kind of situation. It cannot be, should be in a recovery mode rather than it should be anticipatory mode. And not only COVID, but then there are all many other things, disease, which are creating a lot of disturbance in the society. So that probably we need to deal with more in the anticipatory mode so that you are prepared much ahead of the situation and then you take decisions and all. So apart from that, once you have a good handle, probably thinking about food, water, traffic, energy, and all such kind of things are also have a lot of societal impact. Some of them are associated with like food and water. So most of the time, like fruits and all, if they are not reaching to you at appropriate time where food value is high, probably you, though you eat fruits, but food or fruits, but then it will not be useful. So those kind of thinking process also. We are doing some work with CMU. So to come up with a sustainable food supply chain, but if you are interested, or even for agriculture, so there are a lot of wastage of food every year and all. How can you deal with that kind of situation? So similar, I'm just giving some of the analogy which probably can invoke, basically trigger your thinking process, how where digital twin can be used. And then water, definitely availability of water is one, but improving water quality is also we need to think about, because it has a relation with health. And then traffic due to pollution and all, you may have health issues, so you need to, you can think about those. So it's a, so one is ecosystem at healthcare system, and then if you go to our societal system, so you will see a much broader network. So it's a ecosystem of ecosystem will emerge, and that's what probably we should deal with, at least when we're talking about we are we'll be kind of sustainable, we'll live in a sustainable world in 2050 or 2060 or whatever the target is. So we need to deal with those kind of complexities. With that, I'll stop here, but I'll be happy to take any question, or if you are interested, go to the next slide. So if you are interested, we can have a discussion later point of time. Thank you.
Yeah, thank you.